Okay, so welcome to Dr. Dana DeHart. Dr. DeHart is a research professor in the College of Social Work here at the University of South Carolina. So I've come across her work before. I'm pretty new to the university. I was excited when I found out, oh, she's actually here at the same university. Dr. DeHart's work is really interesting and relevant to our class in Women in Crime. So she studies things like health of women and girls in incarceration settings. So that's, and do you study men and boys as well, Dr. DeHart, or?
Not so much. I mean, I actually have studied some impact of incarceration on families, and that includes dudes, but not so much for most of my work. Most of it's girls and women.
Great. Yeah, in our class, we also do talk a little bit about that, the kind of effects, larger effects of the legal system and incarceration on the family and communities. So I already got a sneak peek of her slides, and I'm really excited for her talk. So let's welcome Dr. DeHart. Turn it over to you.
Okay, well, thanks, y'all, and I thank you for the invitation. I actually appreciate this, and I had been thinking about presenting on this topic for something in December, so this is helping me get my act together and bring it all into a slide presentation. So I'm in a College of Social Work right now. My actual training is in social psychology, and my work along the way has been pretty transdisciplinary. I study the intersections of victimization and offending, and in doing so, I worked at a transdisciplinary center for a long time and then moved over into the College of Social Work, where there's more of a social justice type of focus in terms of how people are approaching crime and criminalization and things like that. I recently completed a book with my bud Shannon Lynch, and that is on women's and girls' pathways, yay, into the criminal, or through the criminal legal system. And in that book, we talk about women's entry into the system, their experiences within it, and experiences of reentry. And so today, because I've got a few active grants dealing with health and mental health issues, I thought I would address health and mental health as they relate to those phases of being entering into the system, being in the system, and then re-entering communities. So I'm going to take you through that theme, and I'm going to work from a few different data sets that I've had over the years. And I'll stop periodically and make sure folks don't have any questions or anything, probably after each slide. So let's see if I could get this going. All right, so I've been researching system-involved women and girls for about 20 years. So I think my first study was, actually, I did a postdoc back in 1995, and I was working with Diane Follingstad, and she was looking at battered women who had killed or assaulted their partners. And that's how I sort of got into this topic. And after working with her, where we'd gotten into the South Carolina prison systems here and done some surveys with women, I really wanted to get more into the qualitative and mixed methods depths of interviews with these women and learn about victimization, not just as it related to these sort of culminating events in their relationships, but rather over the lifespan, how they had experienced victimization and how that intersected with their entry into criminal activity and the escalation of their criminal activity. And so I began with a study that was funded by National Institute of Justice, and that was 60 women here in a max security prison at Camille Griffin Graham facility. And I just did narrative interviews with those women. And what I ended up finding, and I'll describe some of the findings in some of the later slides, were these overwhelming histories of victimization and adversity. And that got me thinking that I really needed to try to examine victimization way earlier in people's lives, because by the time I was talking to these women, they had already experienced so much, and it was so intense and so overwhelming. I felt like I just couldn't tease out any of those relationships about criminality and their victimization. So I then did a study, also funded by NIJ, of 100 girls who were in detention here at the Department of Juvenile Justice in South Carolina. And that included girls who were in a long-term commitment, which is a secure confinement facility. And I don't think they're actually holding girls like that anymore here in South Carolina. There were also girls who were in 2 secure group homes. One was a mid-level management group home, and one was a high-level management group home. And those were like 15 girls per home living together with staff members who would allow them to cook meals and do things like that. And again, I found just really huge levels of victimization and adversity. In that study, we looked more at their trajectories of offending and how these related to trajectories of victimization. That led me to some collaborations with people because my work was starting to get out there a little bit. I got a call from Shannon Lynch, my co-author on the most recent book, and she had seen an RFP coming out of NIJ for a study on women's pathways to jail. And so she had cold called me and Joanne Belknap and Bonnie Green and asked us all, did we want to go in on a study with her? And so we decided, we wrote up a mixed methods design where we would interview women in jails in each of our respective locations. So Bonnie was out in the DC metro area, which involved jails in Virginia and Maryland. And Joanne was in Colorado. Shannon was in rural Idaho. And I was here in South Carolina. And we interviewed these women in jails. It was almost 500 women. And we gave them clinical diagnostic interviews. So I actually used some grad students from psych to go in and do the clinical diagnostic interviews for me. And then I followed up with a subset of these women, and they did the similar things at each site, where we did life history calendar interviews with the women to get them to map out different experiences over their lives. And I'm not sure if you'll be able to see this, but for the life history calendar, we just printed out these huge sheets of paper that have like periods of their life across the top. So in this one, I've got like their early childhood, middle childhood, adolescence. Then I've got like their 20s, 30s, and so on going across the top. And then along the side, I have different types of events, their relationship partners, their use of alcohol and drugs, crime and delinquency experiences, and so on. And you sit down with the person side by side, and you just sort of go through and you draw lines and X's and make notes to map out when different events happen in their lives. Then you change that into, after you get out of the interview, you spend the next 6 hours of your day entering quantitative data to show the duration of victimization and onset of victimization in their lives, and you also enter the narrative from your notes to get the qualitative data. And so that really allowed a rich data set. So we got a lot of different pubs from that, just from our big sample of almost 500 women, as well as the subset of women that we've done those life history calendar interviews with. And then finally, most recently, one of the samples I'm going to talk about today was funded through research from the South Carolina Center for Rural and Primary Health Care. And they're interested in rural health in South Carolina, and they had found out that some legislator was interested in funding research that affected sort of his area of South Carolina where there was a prison located. And so we were looking at rural areas of South Carolina, and I'm particularly interested in looking at the reentry experiences of women. So we were looking at reentry for women who were either from rural areas or going back to rural areas. So I talked to, not only did I talk to folks working in the criminal legal system at that point in time, so I talked to like the prison administrators and correctional officers and clinicians at SCDC, but I also talked to people at probation and parole, the Alston Wilkes Society, some healthcare providers and mental health providers in the community, and so on. And then I did focus groups with 35 women. So some of them were focus groups of women that were currently incarcerated and were about to get out. And some of them were either individual interviews or groups with women who had recently been released, either from prison or jail. And we had started out wanting to just talk to women released from prison, but COVID hit right in the midst of this study, and it got to be very difficult to do any recruitment at that point in time. So that's sort of a mixed sample of women. So as you can see, as I've been rambling about the different sampling sources, if you're looking at these stats up here, you can see that there's just a ton of victimization and adversity. These women and girls have been through horrible things in overwhelming magnitude over the course of their life. And often it was piled on top of, just one thing after another thing after another thing. And they often had co-occurring substance use disorders and mental health disorders. And they also represented sort of a broad range of different folks. But keep in mind, as we talk about the impact of health and mental health in these women's lives, that the folks that are even more marginalized, folks that are racial and ethnic minority communities, persons of color, are going to have a harder time even and be more surveilled, more arrested, more sent away than are the folks who are less marginalized. And so those are things to keep in mind as we talk about how these experiences relate to criminal legal involvement. So do y'all have any questions just about that slide before I move on to some of the pathways between victimization and offending?
And you all could just, we're a small group, unmute yourself and talk, or you could type in the chat box a question and I can share that with Dr. DeHart. It's up to you.
Okay, hearing none, I shall proceed. All right, so when we first looked at this data, some of the things that became clear were that there were a lot of different pathways that could lead from victimization and adversity to involvement in criminal activity or escalation of criminal activity. And so one of the things that was very striking is that often began very early in life. And again, that's the thing that sort of prompted me to go from studying those adult women in max security to then looking at the girls that were in juvenile facilities. So often I'd hear cases of parental corruption where parents were getting their kids to go into a store and shoplift, or getting them to take some bags of weed to school to sell. Parents were sometimes pimping their kids out. So, and I'll give you quotes throughout. Here's a quote from about a girl named Chantel. She left home because of the drug use. Her mom and dad were high all the time, men coming in and out of the house. They'd go straight to Chantel's room. Her parents would take the money, the keys to the car, whatever. She laid there and took it. It started as fondling, but there was also intercourse. It happened whenever anyone came by with money, every weekend, and sometimes during the week. And so you'd see this coming from parents. You'd also see similar experiences as the women grew older coming from partners, where partners would pimp them out, partners would coerce them into criminal activity. We also saw both parents and partners introducing people to substances and getting them hooked. And particularly when I was talking to the girls in juvenile facilities, they were dating like old dudes, and even some of them were dating old women. And so it's like, they're 13 or 15 and dating people in their 20s. And those folks are introducing them to drugs and alcohol and stealing and things like that. Their parents were often introducing them to this. And here's a quote from a girl I'll call Jenna. She said she did OxyContin with her mom the first time. It was weird because her mom patted her on the back for snorting it. Like most kids get patted on the back for by their moms for playing sports or something. And Jenna's mom patted her on the back for snorting pills. It made her feel like a badass, kind of cool. We also found that people were using alcohol and drugs to numb from abuse. So there was often overwhelming victimization and adversity either in their households or elsewhere in their life. And they were just chugging alcohol or doing drugs to try to cope with that. So, for instance, one girl, Laura, told me about being sexually abused by her stepfather. He'd do things like shove sweat socks in her mouth to keep her from screaming while he was raping her. And she would say she found out it was easier to deal with it if she was drunk. So she would see him looking at her like he was going to do it, and she would just drink a half bottle of vodka so that she could cope with that experience. Later on, she actually was implicated in the murder of her mother, and the newspapers never mentioned any of the abuse experiences or anything like that. They just talked about how she started to become a wayward girl when her mom remarried. And so a lot of that gets hidden behind the scenes that you're not necessarily seeing in public accounts of crime and delinquency. We also have situations where, as I'm sure you've heard about, where people use defensive or retaliatory violence against their partners. So in the particular case of Laura, she had killed her mother in partnership with her boyfriend at the time. And, in her account to me, she said that she didn't know that that's what was going to go down. But, some would say that maybe she knew what was going to go down. Whatever the story, it could have been a defensive or it could have been a retaliatory thing because her mom sort of denied the existence of the abuse going on in her lifetime. But there were also so many stories that I heard from women who were being brutally beaten or stalked by partners, and they ended up, setting that person's house on fire or doing other retaliatory violence or doing defensive violence where they shot or stabbed someone while they were being attacked, and then they end up going away for a manslaughter crime, which still is, like 7 years behind bars for something where, if you're being beaten with a bat at the time, you would think that you might not have to be put away for that. But in a lot of these cases, that was actually the case. Sometimes the partners who were stalking them would create such chaos in their lives that the women were pushed out of their homes or their employment. So one woman, Bonnie, told me that she'd go and leave the batterer's house to go stay with the girl across the street, but then he'd come over there and he'd start throwing rocks through the window, and she felt like she was putting other people through misery, so she just sort of went out on her own. And then she lost her job because he'd mess up her face so bad that she'd go to work with all these bruises, and she'd be in late and she'd miss work. And so then, once these women end up out of work, out of a home, they end up in a very desperate state where on the streets often, or staying, couch surfing with friends, they end up trying sex work or shoplifting or other means to try to actually create a living. So what we actually saw in these stories was what you might expect is, a lot of victimization leads to a lot of health and mental health issues, particularly substance use issues and things like that. But the levels of victimization that these women experienced were just extraordinary. And in fact, in doing my studies with women in prisons and jails over the year, still looking back at my first sample of the women who were in max security, it just blew me away what they had experienced over the course of their lifetimes. You wonder how they ever had a chance to survive in the first place. And often it was just, they got kicked when they were down with, again, one thing after another, and it has this cumulative impact. So for instance, this one girl said that when she was 14, her mom was shot. And so when her mom was shot, her mom had to go to the hospital. And so she went to stay at her uncle's house, but her uncle raped her and she got pregnant. And her mom was still in intensive care, so she couldn't tell her mom. She didn't really talk to her grandmother much about it, but her grandmother knew she was pregnant, and her grandmother was too ashamed to go with her to get an abortion. And this girl, Kelly, had said that she had just lied and said it was someone off the street because she didn't want to say it was her uncle that had done it. So she had to go by herself to get the abortion. And she wanted to keep the baby. And she found out when she went for the abortion that it was actually twins. And so she just thought people would think less of her. And so you think about, and she, you know, she was thinking about the shape that her mom was in. She didn't want to bring any pain on the family. And shortly after all that went down, she first tried marijuana. She joined a gang. And shortly after that, she began committing armed robberies of stores and motels. And within a year or two, she had begun to regularly shoot up cocaine. So, you know, the cumulative impact of just, you know, your mom's shot, you're getting raped, you have to have an abortion, you find out it's twins, you or the family's ashamed of you, and it just goes on and on. And what you can really infer from all this is what these girls and women are dealing with are extraordinary circumstances of loss and adversity and trauma. What they are enacting in some cases is actually coerced, and in other cases it's not coerced, but they are clearly strategies for survival, just trying to get by, just trying to cope. And it's hitting the marginalized people the hardest. As Beth Ritchie has titled a book, Compelled to Crime, is really a way to describe what is occurring in many of these cases. And because we refer to it as being compelled to crime, that doesn't really remove the agency of the individuals who are involved, but it does contextualize that. And it gives you a sense of how this convergence of things like, you know, a pre-existing vulnerability to a mental health disorder might mix with household and neighborhood adversity and individual victimization and structural oppression to all come together and really push these girls and women out of their homes, out of their schools, out of their churches, out of the places where they would normally go to support, and instead just put them out there on the streets, making them desperate and making them vulnerable to exploitation. So what we really have is a very horrible situation for these women. Do you all have any questions at this point before I advance to the next slide?
I have a question
Okay.
from Katie. Is there any information about the cycle of victimization on these ladies that were studied? I don't know when she asked that question, but.
Well, there is actually, in terms of, I actually do have information on violence in their homes of origin. So they were often growing up witnessing violence. They also experienced violence themselves. They also, after they became involved in delinquent or criminal activity, were subject to further violence. So if they're trying to deal or trying to do some sex work, they might end up being beaten or mugged by Johns in that process. So if you're talking about the intergenerational cycle, that was certainly evident. And in terms of the cycle of violence of the honeymoon and all that stuff, if you're talking about that more immediate cycle, yes, they definitely told stories of that in terms of returning and leaving and returning. But most often what we are seeing in a lot of these cases are they leave and they get stalked, and they are pretty much hunted down and brought back. So in terms of that immediate cycle, the honeymoon cycle type of cycle, that if you're talking about that aspect of it, I would just underscore what Jackie Campbell and other researchers talk about in terms of the time when you leave is the most dangerous time of the relationship. And so it's not necessarily as easy as folks sometimes think that it may be. So does that answer the question? Or now let me see if I can get back to my notes page. Okay. So should I launch back in, or we should wait for folks a little bit?
Let me just reclaim host just so I can. they're probably, I think we had 12 in before. So I'll watch it and I'll let them back in, but I'll let you get back started. And I do see your slides and your face. So you are good to go. Sorry about that.
Well, if you want to wait a couple minutes for them, that's cool too.
I think there was 12 and we have 12 now.
Oh, okay, okay.
Yeah,
All right,
so
cool.
I'll keep an eye on it, but you can go ahead and get started.
Okay, so another study that I've more recently done beyond those, well, it's more recent than 3 of those 4 that I just drew from, has to do with impact of incarceration on families. And so in this study, we got administrative data from SC Department of Corrections, and we matched it to a ton of other data from social services and medical services and DJJ and all that stuff. And so we got data for about 20,000 people who had been incarcerated during a certain time frame, like 2006 to 2008, and then for anyone who had ever visited them. And so that was like another 50,000 people. And we were able to have this cross-agency social service data for all those people in order to look at whether someone's incarceration was associated with like health issues for either them or their visiting family members, before, during, and after the incarceration. And that study, we actually supplemented the administrative data with a bunch of qualitative data. And that qualitative data, we had a couple of groups of guys from, I can't remember that, from Turbeville. We had a group of youthful offenders from Turbeville and 2 groups of older dudes from Turbeville. And then we had 4 groups of women at Camille Griffin Graham. And then we also had some interviews with their family members and things like that. And so in that study, we were looking at the impact of incarceration on the prisoners and their families. And what we found was that they discussed a lot about how the incarcerative experience was a stressor due to the limited communication they were able to have. And again, this is pre-COVID, when things were actually probably better than they are now. They had a lot of family stress. They were experiencing loneliness and isolation. And for both them and their family members, they were having worsening mental and physical health, as well as having issues with poor diet and limited health care while inside. So some of the things, I'll just give you a few examples from that. They would talk about how whenever they got calls, they felt like both the family members and the prisoners would say they felt like they needed to hold back because they didn't want to create like trauma and stress while they were at a distance communicating. And so like one woman said, you got to read between the lines. My uncle was dead for a year. They didn't tell me. You're not really part of the family anymore. They don't want to tell you anything. They say, I don't want you to worry. And like some of the dudes would say, well, you can't, like you're afraid to say anything because you're afraid that they'll get mad and hang up on you, and then you don't know when they're ever gonna, answer the phone or call back again. And so it was that lack of communication was very traumatic for them. They experienced stress, the prisoners did, but also they experienced stress from their families being stressed. So one woman told me that her mom was so stressed out, she hears my voice and she cries every time she talks to me. Another woman said, legal fees, phone visits, the phone calls, visits, these all build up. Your family sends you money. My dad keeps a stack of the money orders he sends me. He calls it his retirement fund. And so the prisoners actually feel like they are depleting their family's resources, and they face stressors not only from what they're coping with on the inside, but from how their families are doing on the outside, as well as issues around their parenting. They say, how am I supposed to parent? I'm just a voice on the phone. And there are gatekeepers who are sometimes blocking them from parenting and blocking the kids from visits and bad mouthing them while they're behind the walls and stuff like that. So there are a lot of different dynamics that go on. They also talked about, they have limitations in terms of the types of health care they receive. And actually the next study I'll talk about really sheds more light on that. But you think about this in terms of they're in there and they're not getting better. Things are getting worse while they're on the inside of the walls of the prison. And so this most recent study that I'm working on now, we talked to 27 women in a focus group and 2 focus groups at Camille Griffin Graham, and then 8 women who had recently been released that were residing in the Greenwood area, because again, we were trying to focus on rural areas. And so almost half of them rated their health as fair or poor as opposed to good or excellent. So they're not doing in great shape. And a lot of them, as you saw in one of the first slides, had a lot of chronic conditions. A lot of them have Hep C, others have diabetes, things like that, and just a lot of different issues that they're dealing with their health. And their conditions often worsened inside, especially around gendered needs. The women in the focus group told me things like, when we have medical issues like a urinary tract infection or yeast infection, we have to go through the whole sick call process. Then once you actually see a doctor, it's been 2 weeks. It's 2 weeks before you see a doctor, and then once you see a doctor, they need to put in an order for the meds, and then you have to wait for that. That's a long time with a yeast infection. Another woman said, I'm a cancer survivor, and it took me 5 years to get bras and a prosthetic. I've been hiding it. I still don't let people see me in the nude. I feel deformed. It causes anxiety, and it puts your self-esteem in the garbage can. Another woman was talking about dentures. It took her forever to get dentures. And she was like, you can't look yourself in the mirror if if your teeth are all messed up, you can't look at yourself. And so they were saying, your self-esteem, that's what lifts us. Walking out that door, you still want to walk with your head high, not belittled and berated and abused and rejected. They also brought up the hygiene and cleanliness of the facilities. And again, this is pre-COVID. And so they were talking about, what you do if you want to clean the bathrooms. We clean them with someone's personal shampoo. The water sits in the bathrooms, it causes foot fungus, and medical doesn't do anything about your feet. They also talked about the continuity of care that they experienced, because a lot of them had already been released from prison and bounced back into prison. And so they said, they only give you 2 weeks worth of meds when you leave here. You go into withdrawal, and that's when some people fall back and go hunt for something. They wind up back in here. Another woman said, when you get out of here, you're just kind of put out there on your own. It's kind of overwhelming. Another said, the taxi doesn't come to my address, and there's no city bus. They told me where I'm supposed to go once I'm out to get my meds, but how am I supposed to get there? Fly? So they're not well prepared for getting out. And once they're out, they sort of feel like they've been plopped down there in the middle of things without a lot of resources and without a lot of support. And the women that I interviewed in communities really did seem ill prepared to deal with sort of managing their own health. It seems like such a lower order need in terms of the hierarchy of things that they're looking for. And when you look at reentry programs are often dealing with the things that are musts, like they must have housing and they must have employment, but their mental health and often their substance use treatment needs and their health care are often a little further down on the hierarchy. And without addressing those things, it's hard to maintain the housing and the employment and so on. So what we're actually hoping to do with this study, now that we're in a later year of the funding, we are hoping to develop some materials. We want to provide materials for community providers like healthcare providers and mental health providers to help them understand the types of things that the women are going through when they're coming back into communities, that they're not just lame slackers, that they're trying to meet a lot of different demands all at one time, and that they've also got a lot of co-occurring disorders going on that are affecting their cognitive loads and everything else. So we're trying to develop tools for providers. We're still trying to figure out exactly what those are going to be. There are some screens that are made to try to facilitate conversations between healthcare providers and persons that are reentering communities. So it might be something along those lines, or it might be something along the lines of telling providers about the types of things that are well treated and not well treated in prison, where the women might need catch-up care and so on. We're also trying to develop some sort of curriculum for the women, and this was originally going to be delivered as an in-person multi-session curriculum to the pre-release women. Now it's looking like we're going to have to figure out a more creative way to develop that. But we're thinking of something surrounding just chronic disease management or healthcare management that's a little bit lower level than what is typically presented to laypersons in the communities, because again, these women have a whole lot of needs, and trying to say, oh, you know, monitor your blood pressure or something like that is a little, it's a little superfluous compared to just trying to keep it together, which is often what they're trying to do. So we're trying to figure out how to tailor a curriculum to them and what formats for administration would be best in terms of these, are these workbooks, are these online things, are these apps of some sort. We're not really sure yet. We're still trying to figure it all out. So I'm interested in any input y'all have around that. So then the final thing I want to talk about just has to do a little bit with the implications of all this. So if you think about all the different issues that these girls and women are facing, we have decided that locking them up is the way to fix that. And that is not really a very functional fix. If you consider, you know, their victimization, their mental health, their substance use disorders, the cognitive load of trying to find a job and get to the social service office and get back your kids and keep your housing and get along with your family members whose relationship you may have impeded long ago. There's a lot of things going on in their lives. And these systems that we have developed are very punitive, and that includes not only the jails and the prisons, but also some of the other systems that we have in place. So the women are often dealing with child protective services who are surveilling their behavior in certain ways, juvenile justice systems with their kids, and law enforcement still monitoring, and probation and parole officers coming around. And what I'm hearing from the women that I've been talking to for the last 20 years is that all these systems were around while they were growing up, and these systems didn't keep them from winding up where they wound up. So we really have to think about transferring our perspective from trying to catch people in activities, you know, particularly after they're getting out, to try to catch them for technical violations that aren't even considered crimes for other people, things like drinking and things like that. And instead going to a system of trying to build supports and create pro-social avenues for them to actually make connections to communities. We know that incarceration is not ameliorating social problems. It is actually becoming a worsening and worsening problem as time goes on. And resources probably would be better if diverted for things like health and family well-being, the social needs that these people have. So if we could try to reduce collateral consequences that these women face when they get on the outside, provide trauma-informed and gender-responsive approaches. There was a recent article by Fishbane and a few others that talked about using nudges about showing up for court dates. And I can imagine doing the same thing for probation and parole or things like that, even though I think probation and parole is something that we need to notch down quite a bit in the first place. But in Fishbane's study, what they did was just redesign the forms so that the information about where you have to be and when you have to be there and what the penalty is for not being there was more salient. And then they text messaged people a few times beforehand to try to remind them to come. And we just don't do stuff like that just to nudge people into the right direction to try to support them in navigating the reentry process and trying to reintegrate into communities. I'm not sure if y'all have read Danielle Sered's book, Until We Reckon, but in that book, there's discussion about establishing dialogues around accountability and reducing fear and isolation, both for the offenders and those persons that are victimized. And although it's not appropriate to all types of crime, for instance, things like domestic and interpersonal violence crimes are not good for these victim offender dialogues. Other types of violent crimes and other types of crimes, victim offender dialogues have been very successfully used. And they've been used to try to reduce the fear that people experience, as opposed to just letting someone sit behind bars without any programming for year after year after year, because there isn't a lot of programming going on behind the walls. And so if you are sending people away, not doing much for them, and then returning them to communities, you're doing a disservice to the victims or survivors of their crimes, these persons who have been incarcerated, to their families, and to their communities. So we need to think about ways to connect people in meaningful ways to services, to relationships, and to having a sense of purpose in their communities, perhaps through advocacy and other means like that. So that's all I got.
I was muted, as usual.
Okay.
I'm here. Thank you so much. I have about 4,000 questions, but I hope over the years, we'll get to talk a lot about this. So I want to open it up to the floor first to see if there's any questions for Dr. DeHart. Again, you could type it in the chat box or unmute yourself and talk. So go ahead.
And I don't see the chat box, so.
Yeah, I've got an eye on it.
Okay, cool.
I think while people kind of gather themselves, I'm gonna start off with one. One question that I had, and I really appreciate your talking about methods. That was really cool to hear, because we do read a good bit about that in Women in Crime. You mentioned narrative interviews. I was wondering if you could talk about what a narrative approach to data collection is and whether that would fit under a feminist methodology.
Well, that question is probably too sophisticated for me, but what I was referring to is basically just using open-ended responses, so questions and prompts and responses. So I tend to do life history interviews, and that's what I was talking about, more of a narrative where we're just talking about having the women, me giving some prompts, the women tell me more about their lives from their own subjective perspective, and me following up and sort of jumping around as needed to follow up on things. Now, I'm not sure that that's going to meet the technical depth of what you get in the research methods class of narrative, and in fact, I think it's a little bit different. But I was contrasting that to the use of those life history calendar interviews, in which it's a more structured approach where we're actually trying to pin things down to the timing of when things occurred, because the timing data was going to give me what preceded what and how long things went on and what things coincided in their life. And actually we found that the girls and women really dig that life history calendar approach. It's almost, even though they're talking about bummer stuff, it's like it's it's almost an entertaining activity for them, and it's an insight building activity for them. And in fact, some people use those life history calendars as sort of an intervention approach also in delivery of services.
That's really awesome. So I'm quantitative, but being a feminist criminologist and teaching these classes that I teach, I just think it's so powerful to do that, just in not only giving these women or participants in general a voice, but I think about those checklists that they could have developed off of, men's entry into prisons. And if you just hand that to women, you're missing an entire story. As well as, I would definitely argue that it's feminist and that it also can support them and help them. That's one thing that surprised me in my work, that it's mostly close-ended, but those open-ended spaces, people sometimes take the time to say, thank you. I've never thought about things like this. Like, I've really started to make sense of what's happened to me. So I think that's really powerful.
And in fact, I could say that most of the girls and women actually, they were spreading the word about the interviews. Whenever I would go on site, people would come up to me and ask me, can you interview me? Can you interview me? And so it got to be something that everyone wanted to participate in. So I would say that it was definitely something that the women saw as beneficial. And it got to the point where women were saying, that they were talking to their counselors, and their counselors said it might be good for them to do this. And the word was getting around the facilities that it was something that the women were liking and appreciating.
That's actually perfectly aligned with the next question we had from a student, Sam. Sam said, how do you find women who are willing to participate in these studies, especially since the topics are very hard to talk about?
Well, in prison or in a juvenile facility, there are not a lot of activities, and your main activity would be a work detail. And so we would go in and invite people, and the vast majority of people that we invited in those secure facilities would participate. Now, once you're on the outside trying to interview folks, I tried to do a study of juvenile probationers, and that was really hard because you're trying to track down sometimes alternate caregivers for a particular youth over time, and that got to be really tricky. And I also, in doing the interviews with the women who had re-entered just as COVID was coming around, it was really hard to try to get people to call back, and their phone numbers would be disconnected and all that. So I think, and I think also there's reticence because, like, a lot of them were on parole. So, like, are you going to really want to talk to someone when you're on parole and tell them some extra stuff about yourself? Because they're going to be apprehensive that it's somehow going to get back to triple P. And so that there can be some reticence on that part. But I have found that particularly in those secure facilities, people really do want to talk about it. It's the only opportunity to talk about it. And they say that you can't talk about that stuff to anyone else, because if you open up to someone else that's behind bars, you're in there for a while. 2 months later or 2 years later, that person might not be getting along with you, and that information might come back to bite you. And so they actually enjoyed the opportunity to have someone that wasn't a counselor and wasn't another incarcerated person, just to be able to tell their story too.
Mm-hmm. Wow. Sam said, thank you. I have another question from Naomi. So do you ask the women what their perspective is on how they think the system should change?
Yes, we are definitely asking that. Yeah, I always ask that as one of the things in terms of the types of things I ask at the end of interviews. And one of the reasons I ask that is because it's one of the things that you can actually do to help bring people up at the end of an interview where they've just talked about a whole lot of bad stuff. So we tend to ask them about things that they're proud of and their strengths and so on, but also things that they would like to see improved. And it's hard to get really concrete recommendations, because I feel like a lot of them don't necessarily know what all the options are or what could be feasible options. But definitely in this newest health research, we had asked the women about what types of things they would like to see changed. And I'm hoping to actually bounce some ideas when we start to develop the tools for providers and the curricula for women. I'm hoping to maybe talk to some more incarcerated persons and persons that have recently reentered to find out whether they think that any of this stuff would be helpful or not before we try to roll it out. But yeah, I mean, we do talk to them. I just feel like in the place that they are when I'm talking to them, they don't necessarily have all of the information to make the most advanced arguments about what could be changed. It would almost take them being out a little bit and maybe getting involved in some advocacy efforts on the outside. Because remember also that so many prisons are restricting access to books, so they can't be reading about, they probably are not reading Michelle Alexander,
right,
or any of that stuff in these prisons. When we tried to give money to the general fund and the jails so that the women could buy books, the jail bought Bibles with the money that we gave them.
Wow.
As incentive. So it's not necessarily a free thought environment, and the women aren't given a lot of resources to try to organize or develop advocacy for themselves in that context.
Do you think, so I know it's been encouraging for a lot of folks that, oh, Naomi said thank you. It's been encouraging to see more bipartisan, kind of across the aisle action on juvenile justice reform and criminal justice reform in recent years. From where I sit, a lot of the conversation seems to be geared towards nonviolent male drug offenders. That's where a lot of the conversation is. Do you see this important knowledge and work around women and the kind of things that you study involved in those conversations?
Well, you brought up something that's really interesting, and I was going to bring up something else. Have you seen, is this being shared right now?
Yes, I see it.
Okay. This is a incarceration in real numbers, which actually gives you visualization of incarceration in real numbers. And then as you scroll through how many people are incarcerated in the US, it gives you different policy, like it'll give you some blurbs along the way about different statistics. Almost no one gets a trial because everyone's plea bargaining. But one of the things it shows when you get down toward the end, there are some graphs where this will allow you to, oh, where'd you go? There are some graphs where it shows like if we just did release of nonviolent offenders, how much would this change things? And it shows that a lot of the proposed reforms wouldn't make a dent in this situation that we have going on. And instead, we have to be considering violent offenders as well, and probably looking at what other countries are doing more so than looking at what's amenable to both sides of the aisle as it currently exists, because other countries have already done things like put caps on the amount of time that people can be incarcerated and things like that. So I'm not sure if that answered the question though.
Yeah. And of course, the first thing I noticed was those are men, symbols of men in the background. Thinking of course that women wear pants too, but I noticed that a lot in the public and political sphere when we talk about crime, where no one's really talking about women and their particular needs. We're almost out of time. I thought I'd ask one question. So I have a lot of great students in this class, and all of my classes really, and a lot of them want to know, I know some are interested in law school or law enforcement, things like that. If this women in crime class, even though it was online, was their favorite class, which I know it's going to be, what are the kinds of paths forward, career-wise, or occupations you can think of? Obviously, the research grad school side, but do you know of any kind of positions that they might want to pursue if they're really into the idea of helping survivors and women who are incarcerated?
See, I'm going to go with becoming involved in either research or legal services, because I think that's where most of our paths forward would really get the most bang for the buck. Because we are starting to really understand, and I mean, of course, there's social work if you want more of a helping profession. But in terms of where we're actually seeing the change enacted, I think the changes that we're seeing enacted are in criminal defense and in criminal prosecution, as well as in research partnerships with those that are in communities. So those would be my preferences. But again, I'm not a social worker, and I'm not a clinician, and I'm not a criminologist. And so I'm always just going to go for a whole, I want to find out more about things, research approach to things.
Right. That's where my mind's at, and that's why I try to get other voices in the room, because not everyone wants to go to grad school, but there's a lot you could do with a master's degree in criminology and related fields in terms of working for the DOJ, NIJ, CDC. So they know they can always come to me, and now they have a new person that they may bug asking about research jobs.
Although I'm not going to be on campus.
I'm hiding away in my house.
Right here.
All right, so we're about out of time. I want to thank you, Dr. DeHart. This was everything I wanted to hear and more. I really, really enjoyed your book, and I know they learned a lot too. So it was great seeing sort of all of you. And just send me an email, or Dr. DeHart, if you want maybe to get some more information on this research. You could always pick up her book as well. So thank you, everybody.
Thanks, y'all. Thanks for inviting me. And Kate, if you ever want to collaborate on stuff, give me a holler.
Yeah. My mind is buzzing right now, so I'm really excited to have made that connection. So, all right, folks, you have a great day, and be in touch if you need anything.
All right, thanks, y'all.
Thank you.